Welcome to the UCVM VCDS video podcast, making veterinary education free open access worldwide.
I'm Serge.
And I'm Soren.
And thank you for joining us. What do we have today, Soren? What's on the books?
Yeah, so today we're going to focus on some of the normal findings that we see when we do lung ultrasound. So we put the probe on the thorax and we see the lung. What are some of the normal findings that we're going to see? Look at the prior podcast we did if you want to know more about the glide sign, but let's talk about what else we see and what those structures represent.
Yeah, so remember we start with the bad sign to kind of help us orient ourselves. We have the probe in perpendicular position, and then that first bright white line that we see below those rib heads is going to be our pleural line.
And let's talk about what else we see then, particularly A lines and B lines.
First of all, what does A stand for?
A stands for air. Here's our pleural line. You see the distance between the skin and the pleural line is repeated through the far field.
Oh yeah.
And that is an A line. So all these horizontal, all of these horizontal lines we see here repeating themselves, that's our A line. And A stands for air.
And that's normal.
What is normal in a healthy lung? What is present there?
Air.
So will you have A lines with a healthy lung?
You will have A lines with healthy lungs.
But let's suppose you have a pneumothorax. What's in the pleural space?
Air.
Air. So will you have A lines with pneumothorax?
I guess so, yeah. Huh. Okay.
So this is a key concept. You cannot differentiate healthy from pneumothorax based on the presence of A lines. And tell me, if we have A lines, and if we see the glide sign, do I have a lot of fluid in the lung?
No.
No. So if we see the glide sign, A lines also tell us that we have healthy, dry lung, not a lot of fluid in there.
And now, occasionally, you get these structures, that this line that keeps coming in and out, and to me it looks like some kind of lightsaber.
Okay, so you're talking about vertical white lines.
Vertical.
That are laser-like projections that extend from the lung surface, and this is key. It can't originate on the parietal or thoracic side. Here is our pleural line. So this vertical white line originating from the lung surface, that's our B line. And it is a laser-like projection that extends to the far field and moves back and forth with the rest. So B lines, we'll talk about them more later, are a normal finding if you only find one or two.
I like it. One occasional B line here and there, not a big deal.
That is correct. And our criteria for a B line, if we look at this image here, what are those criteria? What are the things we're looking for? We can see again our pleural line. We see some shimmering, so we do have a glide sign. Occasional is normal. Where does it originate?
The lightsaber, it originates from the visceral pleura.
Which would be in the lung or not in the lung?
In the lung.
At the lung surface.
At the lung surface.
At the lung surface, exactly. It moves back and forth.
So we have a glide.
So we have a glide. And this is key. Yeah. You'll actually see it going to and fro with the glide sign. And again, review our glide sign if you wanted more familiar with that. And how far through the image does it go?
All the way.
So all the way through the far field of the image on your ultrasound scan. What does it do to A lines?
Destroys them.
We know when we have a B line, if it meets those criteria, it's at the lung surface.
Gotcha. So if you have B lines, you don't have a pneumo?
Correct. B lines rule out pneumothorax.
Awesome. So just going back to what Soren was saying, if you see it moving B line, you have a glide.
That is exactly correct. So B lines are a normal finding if you only find one or two.
I like it.
So let's just recap then some of our normal findings. Here we have normal anatomic structures going from the skin surface, subcutaneous tissues, intercostal. There's our bat sign, rib head, shadow, shadow, pleural line. So first question, do we have a glide sign?
Yes.
Do we have A lines? Can you point those out here?
We have A lines. I see them.
Do we have a lot of fluid in the lung? No. Do you see a B line in this image?
I do not.
We don't usually see B lines in a lot of our patients. If we see one occasionally, that's going to be okay.
So we've talked about A lines, we've talked about B lines, we've already talked about the glide sign. Now, sometimes, sir, when I'm moving back too much and I'm hitting something very strange, it seems to be coming from the back end of things. What is this thing that keeps coming in? It looks like a curtain.
Yeah, you think about this, you're in the thorax.
Yep.
And you now slide your probe caudally, eventually you're going to hit the abdomen.
Yep, absolutely.
There is a transition from the thorax to the abdomen, and we can see that as a vertical line, essentially. It looks like a curtain moving back and forth.
Curtain?
When an animal breathes in,
Yep.
which direction, cranial or caudally, if we have the marker cranially, does the diaphragm move?
It moves caudally.
Exactly. So on inspiration, we see this caudal movement of this vertical line, and that is our curtain sign. Important to identify because we don't want to mistake it for pathology. And if you look closely, you can see in the abdominal side, abdominal structures. In this image here, we have the liver and we have a bit of kidney.
Yeah. Kidney, most important organ in the body.
The important thing here, if we see the curtain sign, and we often go looking for that intentionally because we use it a lot to help orientate where the probe is when we're scanning our patients, and we'll actually use it to help us differentiate certain pathologies that we'll talk about in the future. And keep in mind, as you move down from dorsally to ventrally or in the opposite direction, the diaphragm's curved, so you may need to move slightly cranial or caudal at different locations to find that curtain sign.
Yeah, that diaphragm is Bombay shaped. So if I'm seeing that curtain sign, and I know it's the diaphragm, that means I have a glide sign.
We don't want to actually confuse the curtain sign for a glide sign. Let me put it this way. Animal has pneumothorax.
Yes.
And he is trying hard to breathe. Does the diaphragm move when you have a pneumothorax?
Yes.
We will still find in the presence of a pneumothorax that there is a curtain sign, and we can still find that transition. So don't confuse the curtain sign for the presence or absence of a pneumothorax or the presence or absence of a glide sign.
So a curtain sign, it just tells us that's the diaphragm moving. It does not tell us anything else.
Correct.
Like that. He said I'm correct.
Just to recap, here, let's just do a test. What do you think, Serge? Do we have normal lung or abnormal lung?
Whoa!
What was that?
I think that was a beeline.
Normal or abnormal?
Normal.
Okay, good.
So do we have a glide?
If we have a beeline moving back and forth, we have to have a glide. Thus concludes our normal lung anatomy when we're doing thoracic ultrasound, what our anatomic structures are, A lines, B lines, and the curtain sign.
Awesome. Thank you so much for joining us. Merci beaucoup, and see you in a future podcast.
See you soon.
Okay, that's good. Wasn't that short, but...